What happens if my knee replacement fails? Or that's one of the most commonly asked questions by patients who come and see me who have knee arthritis, whom I have recommended for a knee replacement surgery. My name is Dr. T. Bharani Kumar. I'm an orthopedic surgeon at Apollo Specialty Hospitals, Mahanagaram. Let's talk about what would I do or what needs to be done if a knee replacement fails. Is that the end of the road or do we have any other options left? First, before going to why knees fail, let's talk about that knee replacement surgery is a quite successful one and the success rate is more than 90%. That means that out of 100 patients who get operated, 90 to 95% do quite well. Like all other elective surgeries, there is an element of risk associated with it, which I would say is about 5 to 10%. And in these patients, what do I do or what should we do if unfortunately the knee replacement doesn't work or has problems first? So once the patient comes who's had a knee surgery, who's been doing well or complains with pain, then I need to reevaluate and see what is the cause of the pain. There are different reasons why this knee replacement is giving her the pain. First and foremost would be to look at whether she had any infection. I think that is the primary reason most of the patients start getting. If it's a superficial infection, that means infections are on the skin alone, that can be managed with medications. If unfortunately the patient has a deeper infection, again that needs a longer treatment with medications and antibiotics. And there are other reasons as well why these knee replacements fail in the short term. Let's talk about the reason which if the patient comes with knee pain in the first few years or first few months after surgery and the ones who come later on. In the first few months of surgery, the most common reason I told is one is infection. Second, sometimes if the surgery has what we call any imbalance or instability, that means the ligaments in the primary knee replacement, what we do is we rely more on the ligaments of the knee joint. Sometimes if they are not balanced properly or due to unknown reasons, they can cause instability or that may be reason for the pain. So that's why I said we need to find out what is the cause for these knee problems, and then if we find there is a surgical reason, then they might have to think in terms of a revision surgery. That means you have to replace the knee again with the newer implants, and they do work quite well if done for the appropriate reasons.